My name is DJ April Showers of DRT Radio FM and The Truth Radio. And my guest speaker and my co host is Lady of Leisure. Today we will be talking about COVID-19, and I am going to let Miss Lady of Leisure start off and talk about this pandemic.
Hello, everyone. Glad you joined us. First of all, I'm in Illinois and they just issued a new lockdown that's going to start on Friday. So we're basically going back to the first stages that we were in, when COVID first came back in February, March, whatever it was. It's been so long, I can't even remember. But cases are rising astronomically, so much so that it's higher now than it's ever been. It's worse now than it was when we first got hit with the pandemic. So, I kind of want to know how people feel about it. I really want to know if people think that the entire country should be locked down for a while. Because I personally think that the entire country should be locked down for at least 6 months so that we can control the pandemic and, maybe get some medical regimens for it, some treatments for it, because there's still no treatment for it. And what I don't understand with the vaccine allegedly coming out by the end of the year or the beginning of next year, I don't understand how they're going to administer that vaccine to the masses. Because from my understanding, there are very few companies that can store the vaccine because it has to be stored at such a very low temperature in order for it to be effective. And no one has the capacity to store it. So, it's a lot of things in terms of the vaccine that I'm concerned about. One, it's just too quick. Never in the history of vaccines has a vaccine been created, tested, gone through the trials, and given to the public in less than 8 years. The normal time is 10 years from development to mass administration. So I'm not understanding how they came up with this vaccine in less than 6 months. And they're saying, hey, we're going to be able to give it to everybody in December or January. I personally would not take it. I definitely wouldn't allow, if I had children, I wouldn't allow them to take it. So I don't know. It's a very scary situation. How do you even make a vaccine for a disease that you don't even have a treatment for? Like, what are you using to make this vaccine with? What's in it? I don't get it. And I'm very leery of it, actually. But I'm going to go back to the restrictions of the pandemic. And, how do you guys feel about that? How long do you think the restrictions should be? Do you think they should be, mild restrictions like, we were on in before? Or do you think it should be a total, complete shutdown? It's going to be economically hard on everyone, I understand, but it's economically hard on everyone now. And the back and forth. Okay, you can go to work. Okay, now you can't. It does not put people in a more secure position. either financially or emotionally. You know, then you've got all these nuts out here uh, not wearing masks, and you know. So I would really like to know what you guys think about that. Miss April, do you have any comment on the subject?
Well, first of all, um, I need people to realize this is real, okay? And people are dying.
At
And
an alarming number, yes.
people need to understand that it is real. Me personally, um, when it first came out, I was in a frenzy, cleaning, flipping over furniture, and I was terrified. And the numbers wasn't this high. I stayed in my house for 3 months. I only went to the store. But it's real. It's not a hoax. It's what I need people to understand. It's real. I have friends that are in the hospital now on ventilators fighting for their life. I do not feel that putting any restrictions that they're doing, no gyms, no going to museums, no doing anything, but you still have people that are going to their jobs. They're going to work. I think everybody needs to be in the house. Do like Italy, kept everybody in their homes. Start talking. I got somebody at my door.
And I absolutely agree with that.
Yes.
And I'm just so, I don't understand adult people, real adult people, who can't cope with staying home, who can't cope with their children, their very own children, for 6 months. I just don't understand it. I don't understand. Personally, I feel it's extremely selfish, for people to just go out as if COVID-19 doesn't exist. I think if they lock down, I think they should lock down the entire country. I really do. For at least 6 months and get this thing under control. People are complaining about, because here they have asked us not to celebrate the holidays as we normally would. They've asked us to bypass, the Thanksgiving gatherings and the Christmas gatherings. And people are complaining about that, as if I guess it is kind of a foreign concept, but we're in the middle of a pandemic. I don't understand the problem with you not celebrating a holiday one time so that you can have many years of holidays to come. I just don't understand the selfishness of that. And
Okay. My thoughts on, again, until you shut down the whole country.
That's what I said. Yeah, I said that. I think the whole country should be shut down.
Right. Don't tell me to cancel my Thanksgiving. Don't tell me to not go here and do that, because it's going to be a revolving cycle. It's not going to end.
Well, that's true, but you have to understand that, your governor your local officials don't have it in their authority to shut down a country. So they're doing what they can do to safeguard the communities in their state.
And don't get me wrong. I love, well, Mayor, I don't even know what they're doing here in Joliet. I haven't heard anything. But yes, what the mayor of Chicago and what Governor Pritzker have been doing, they have been doing an outstanding job.
Absolutely. I agree with that on the
And
COVID issue. I do agree with that.
if
And
you
in the
are not,
beginning, with no help from the federal government.
if you are not going to give them credit, then that's awful, because they have done their best to protect Illinois.
Now, I fall a little short of that. I think in the beginning they did a great job. I think they could do better, because it all comes down to money. It all comes down to money, because they could have banned travel to the state. They could have banned travel, to any city. Excuse me. And that would have contained the virus better. But they didn't do that. And I think that's something that they should have done, because you cannot monitor who's driving in. You understand what I'm saying?
Yes.
You can't tell people, if you visit, quarantine once you get here for 14 days. Well, most people coming from neighboring states like Indiana, that's 20 minutes away, or Wisconsin, that's 40 minutes away, they're not coming here to stay 2 weeks. So you can't tell people, okay, well, you can come, and when you get here, you've got to quarantine for 14 days. They're not going to be here for 14 days.
No.
It's a constant in and out. It's a turnaround. Most people don't go and visit someone for 14 days. Most people stay a week, 10 days tops, if that long. My kids travel all the time. They go somewhere for a day. They go somewhere for 3 days. They'll fly in this morning and come back tonight. And I think that they could have went further and stopped travel. Just stop people from coming here. If Wisconsin had the highest cases of any other state. It's 20 minutes away. People and Indiana, Wisconsin's 40 minutes away. But people in Chicago drive to Indiana for gas because it's cheaper. They drive to Indiana for cigarettes because it's cheaper. People
It's correct.
live in Indiana, work in Chicago. So you can't stop people from driving in. Not that you can't stop it, you can't monitor them. How do you monitor people driving from Atlanta to Chicago? You can't monitor the amount of people that's coming in by car.
Mm-hmm.
So I think that a local travel ban, would have served us better. They did a great job with what they had. But after 3-4 months, when you're, reviewing the situation and you see how bad it's getting, and you have a better grasp on what's projected to happen, then I feel as if they should have altered some things to meet that projection. So I agree, they've done a great job, but I do believe they could have done more. And I think they did an exceptional job the first few months without any help from the federal government. While Trump was giving other states, goo gobs of money, he was talking about our mayor and our client and not giving us any money.
Yeah.
So I think they did an exceptional job the first few months, but I think since then they could have done better. But you can't really regulate what people are going to do. Here in Chicago, I think the residents here have done a really great job with wearing their masks and things like that. Where I live, you don't walk out and see anybody without a mask on. What I wish more people would do is to put masks on their children. You're standing here, you have on a mask, every adult has on a mask, and then you're standing here with these 4 kids with no mask on.
Yeah. But I think, well, isn't it something if the kids are asthmatic or get bronchial that
Well, that's with anyone
and then
who
I
has.
think they were saying under the ages of 2 they didn't have to wear a mask.
And that's really crazy to me, because when you're talking about infectious diseases under the age of 2, they have not even had all of their immunizations to be protected from all the things that's out here. So I really don't get that. Maybe because under the age of 2, they're not traveling without a parent or going anywhere. You understand what I'm saying?
Yes.
I can see it from that end, but I don't understand it medically.
Right.
Because medically, they're very vulnerable and susceptible to most illnesses out here.
Um,
And I know that it's probably difficult to get a kid 2 years old to wear a mask. And then at 2 years old, they're running around, they're touching everything. So yeah, I think they should be masked. I do. I think they should be masked as well.
okay.
Because they're constantly telling you, the major spread of anything is washing your hands.
So
You
what
know,
I'm going to do is, because on here, we do give facts. So I don't want anybody to ever think that, oh, okay, hold on, let me see. Nairi, would you like to be on panel? Hold on, I've got to. Okay, first of all, I want to welcome Nairi and Pan. Okay. Now let me put the comments up so you can read them. You reading the comments?
I am reading the comments.
Yeah.
No, I'm not in the medical field, but I do have common sense, and I've had children, and I was married to a doctor, and I do know that children's immune system takes a while to build. They don't even have one until they're at least 3 months old.
Okay.
They have not received all of their immunizations by the time they're 3 years old. And if you have a child, you know that because when they go to school, they keep getting them.
Now she put in her sorry. So this is her other comment. Her solutions. Nairi, right?
I agree. I absolutely agree, Nairi. I absolutely agree.
America and allowed essential workers to drive to different cities to work is fine.
I absolutely agree with that. I absolutely agree with that.
Okay. And then yeah. Now she says the under. Yeah. Okay. All right.
No, the shots that they get don't have anything to do with COVID. But what I'm saying is that because they're not fully immunized, they are susceptible, they're more susceptible to contracting something than an older child.
Okay.
And yeah, they do make masks that fit children. Yeah. I have grandchildren. They wear masks. Yeah. They fit.
Okay. I'm putting up the comments.
It's not that, okay. See, here is the confusion with COVID. It's not that 2-year-olds have died. That's not the point. It's not about them getting sick. It's about them, children, being asymptomatic and passing it along to you who will get sick and die. That's the point of the mask. It's to protect yourself and others. Because, a lot of children don't get ill from COVID, but they are carriers. So they can be asymptomatic and pass it on. It's why, they don't want young people in groups. They don't want you, having big parties. Because although you can have COVID and not even know you have COVID, that's asymptomatic. Children can carry it and pass it along, never get sick and kill you. It's not about them getting sick and dying. It's about them passing it along to someone else, like a grandparent or an ill family member. That's the point of it all.
Okay. So what I am showing, okay, hold on, Nairi. I am going to send you the link. What it says, children age 2 and older should wear cloth face coverings.
Yeah.
They are in child care and at school and other group activities. Face coverings will be essential for children to safely return to school, child care, and other group settings. Hold on. I'm going to send Nairi the link. She wants to come in, so let me send her the link. Hold on. So that is okay. Nairi, look in that box. All you do is click on that link and you come in. So 2 and older, they're saying that under the age of 2. And the reason I remember that is because one of our friends, when she brought the baby to the protest, they told her that 2 and under, that they didn't require a mask.
Right.
Yeah.
And see,
So
it's very scary when you have these toddlers, especially as they were saying in daycares, and you know what I'm saying,
yeah,
um, in group settings like that, because they're kids
and they are going to cough and sneeze.
and have a runny
She said,
nose, and they're
now
gonna touch everything.
she says COVID is not killing 2 and under.
That's not the point. Apparently you didn't hear what I said. It's not about
Yeah.
COVID killing children. It's about children being asymptomatic and passing it along to someone else that it could kill. I
Okay.
mean,
Am I
So
maybe?
our
hello,
our
hello, Nairi. How
Hi.
are you doing?
Good.
Lady
How are you?
Alicia, introduce yourself to Nairi.
Hello, ma'am. I sorry to interrupt y'all.
no problem at all. How are
So
you?
good. I agree with you as far as I said that too. That they should have, when they shut down, they should have. When they first shut down at the beginning of this year. Sorry, y'all. That
It,
they should have stopped flying in and out of America. So if you was already out of
absolutely.
America, you just stuck where you at
You
until the airports
exactly.
all open back up. That's what he should have did.
Absolutely agree.
That's
I
all he
absolutely
had to
agree.
do. To be honest with you, if you ask me,
You're
to
right.
me,
Me too.
if it was some people who had it over here, contain it. Don't let nobody fly in and out of America. Fly it, fly nowhere. Stop all the grounds of the airplanes in America and out of America. No flying local. You know what I mean? Like from Milwaukee to Florida. No flying. Period. That's what he should have did. As
I
well as when he shut
absolutely
down.
agree.
That's what he should have did first, and then shut down the rest of Plan B. I guess will be shutting down all the stuff they shut down and just left open the drugstores, the doctor's office, and and the gas station, which we was getting gas and had nowhere to go. I don't, I don't understand where that came from, but yeah. So I agree with you on that. Oh my God, people texting me, calling me. Lord, can y'all hear me?
So for right now, do you think children 2 and under should be wearing masks? Because we know they haven't died from COVID, but they can be a carrier because children, they sneeze. Because they say it comes from what? Sneezing, the droplets in
The
them.
droplets, yeah,
Well,
yeah. I don't
I don't
know
know
if
who. I
under
mean, I'm not
two.
above. I'm not above those. Damn. I'm. I know they said 2 and under. No. Now the reason why
Yeah,
they said it,
I
I
don't
have
think
no idea
under.
because
Yeah,
now, yeah, I do know that people can be carriers, but I'm just gonna give them the benefit of the doubt. If them 2 year olds and under were carriers, I believe they would have changed it to where they would have to wear masks.
I don't know
Can
if
y'all hear me?
under two. We hear you
I,
fine.
yeah, we hear you
I don't
fine.
know if
I'm
they
just
should
saying,
wear them under two, but they're saying at 2 years old they should wear them when they're in a group setting. So I feel like if they should wear them in a group setting, why shouldn't they wear them in a grocery store with more people in it that would be in their daycare classroom?
So did it change? Because I'm not really update. I'm
No,
not
no, no,
really
no,
up.
no.
I'm not
it
up
didn't
to date. But
change.
did it change? Because it used to be 2 and under. They didn't have to wear nothing at all. And I think that was before when the daycares and schools were closed, right?
Right,
No, this is as of now. As of now.
right.
That's
As
why
of
I'm
now,
Okay.
saying,
they're saying two and over. But
yeah.
Okay.
I'm saying, but they're saying like if they're in daycare and things like that. My
Mm-hmm.
question is if they feel that they need a 2 year old needs to wear a mask in daycare where they may have 20, 30 kids,
Uh-huh.
why wouldn't they? Why shouldn't they wear a mask out in a mall where there's hundreds of people or in a
Well, you
grocery
know what?
store?
I didn't. Okay, so now I understand now where you was coming from when you was talking, because I'm a little behind on the COVID and stuff. I'm not updated, but I do know that they said they didn't have to wear them at first, and I guess that was when school and daycares were closed. Now, if they saying go ahead and wear them 2-year-old have to wear them when they're at school and daycare. Well, I will agree with you. I mean, they should wear them out in public too, then.
Exactly. They're
Because
around
you
more
still
people
around people.
exactly.
You still around folks.
They're around people in a grocery store. They are.
I'ma just be honest with y'all. We can listen, we can read on what they say
Understand.
do and don't do, but I think we need to follow our own common sense.
Yeah.
And unfortunately, I got common sense. Not unfortunately. Unfortunately, a lot of people don't have common sense, because what I've
That
been
is
doing
so
is
true.
I feel for the folks who ain't got common sense,
That's so true. That's so
because
true.
I am a medical assistant. I worked around a lot of doctors over the 4 years and a half. So,
Right.
but I'm smart enough to know that whatever the government's saying do as far as mask and wash your hands and hand sanitizer, and don't be around a whole bunch of group of people, 10 and under, 10 people and under. I follow all of that. But I also, in addition to that, I do my own common sense.
Absolutely. Absolutely. Because before we had our first case in the United States, when I heard about it in China, okay, I started wearing a mask. People were laughing at me.
Well, you did right.
All the
I don't
way
know what they was laughing for.
I started wearing a mask. Nobody was wearing a mask, and people were whispering when I would go into places, and this one boy said, "Don't get close to her. She got COVID," because I was wearing a mask.
Hold on, everybody. Just want to let you know that we now have DJ Chuck from the Truth Radio. I'm adding him to the stream now. Everybody say hi to Chuck.
Welcome, Chuck, DJ Chuck.
Talking about is 2 years old. Now, what I'm showing right now, where it says wear a mask. Is it showing on the screen?
Yeah, it says children 2 years of age and older should wear a mask.
But now that's what it says. Okay.
Yes. It says children 2 years of age and older should wear a mask. Help your child, if 2 years of age older, wear a mask when in public. It says when in public, when around people they don't live with. CDC recognizes that wearing masks may not be possible in every situation for some people, but correct and consistent use of masks may be challenging for some children. But yeah, they're saying 2 years age 2 and older, when in public and around people they don't live with, should be wearing a mask.
Okay, so then that's the truth. That's what we got to go with. At first, they wasn't saying, and I think, like I said, that was because some schools were closed.
What they say.
Everything has evolved. You know what I'm saying?
Wait a minute. You didn't finish reading the whole thing.
Okay.
Yeah, finish reading the rest.
It says CDC recognizes that wearing masks may not be possible in every situation or for some people. Correct and consistent use of masks may be challenging for some children, such as children with certain disabilities, including cognitive, intellectual, developmental, sensory, and behavioral disorders. Learn about what you can do if your child or you cannot wear masks in certain situations. Note that wearing a mask is not a substitute for other everyday prevention actions like avoiding close contact with others and washing hands frequently. Now, that, again, for me, that's common sense. But now, if you can't wear a mask, wear a shield.
But you know what I think what it means is them kids that's cognitive, it's going to be hard to keep them on their face. Them kids going to take them off and push them off. And they don't want them over their face. So that's why they try to tell you, at least try to get them.
Okay, you are back in.
I like those blue ones because they're more breathable. But I don't know. They want to. I don't know.
Adding you to the screen, Chuck.
Them cloth ones, them you can't breathe too much out of. But I think they're trying to say like maybe find their favorite cartoon character. Maybe the cognitive kids will keep them on. But that's a hard topic to touch because I understand them kids not gonna keep them on their face. So then what do you do? What do you supposed to do? Then
And
you're supposed to keep them away from people, I guess, and then keep them
I stay exactly. I stay away from you know, the cognitive and children with behavioral disorders and things like that because it's not the norm situation. You know what I'm saying? But when you're talking about a 2-year-old in a normal 2-year-old, put the mask on.
Yeah, but you know what? Some of them normal 2-year-olds don't want nothing over their face.
You're absolutely correct. But I think it's easier for you to get a 2-year-old, a normal 2-year-old to wear a mask than you can one with, you know, some type of disability. Because, you know, 2-year-olds are 2-years.
Mm-hmm.
You know, and if you don't know how to get a 2-year-old to do something, there are lots of tutorials out here on YouTube that will show you how to trick a kid into doing something. You know what I'm saying? You really have to be creative.
Hey, look, they better watch them because I'm so happy I ain't got no 2-year-old.
Listen,
but I get what you're saying.
I have a 2-year-old great grandson. And every time I see him, he reminds me of what's oh God, I can't think of the comedian. But this comedian has a kid who had ADHD. And he said all he wanted to do was run. My great grandson, he runs nonstop until he goes to bed. He's extremely active. I believe he's got some issues too, honestly. It was very difficult for my granddaughter to get him to wear a mask. She said he won't wear it. I don't care what I do. He won't, you know. And I said, okay, give me 3 days.
Oh, and you got him to wear.
Absolutely, because children, he's the type of kid, he is extremely active. And so he constantly wants to do something. And I said, okay, you're going to wear your mask for an hour. You're going to take it off. You got to change it. And he's like, okay, me, Ma, you know.
Oh, you made it into a game. Fun.
I made it into a game.
Well, you had multiple ones. Okay.
We have DJ Chuck from the Truth Radio that's on here. And DJ Chuck, what do you think about children under the ages of 2? Should they wear masks?
We didn't say under the age of 2, April. We said 2 and over.
I mean,
we know under 2 they ain't gonna do it.
Well, 2 and over is the
no kind of trick.
But we're saying that all children should be wearing masks and or some type of cloth because they can become a carrier. I think people should, you know, that would be common sense too, because kids at that age, they got snotty noses. They
all the time
and coughing, and that's how this is transferred, right? With droplets from sneezing and coughing, right?
I think it's the most common way,
So they only have children 2 and older requirements to wear masks.
I don't even think they're requiring the 2-year-olds to wear masks, or I don't think that people know that the CDC has suggested that they wear masks at 2, because our local officials are making that mandate. They're saying if they're 2, you know, they don't have to wear it. But that's not what the CDC is saying.
Good afternoon, everyone.
Hello, everyone. How are you?
All right. So what is the actual question that's being asked?
Should everybody wear masks, including children? We're saying from newborns on up now.
No, we ain't saying that.
Well, that's what,
We ain't
well,
saying that.
well, two
2 years
and older
old.
is what they recommend. So
2 years
under
old.
2, they're saying if you're under 2, that you don't have to wear the mask. But under 2, you're still coughing, sneezing. You're taking the kid around places.
Yeah, I'm scared of kids. I am when
I
it
mean,
comes to
So if
because
you,
a kid will make you sick and damn near kill you, and they'll be fine running around 2 days later.
so if they don't know much about the disease to me to be saying everything. So I think even they should have some type of covering.
I
So
mean, me personally, I think everyone should have a mask. Adults, children, teenagers. I mean, because not only you protecting yourself, you're protecting yourself from others that may actually have the virus.
because I look at it like, okay, you're saying that they don't have to wear masks. Okay, so we really don't know much about this, and then we don't know how long this stays dormant. So what if these kids now that have come in contact with these people grow up and then they end up with health ailments and then they're all dying?
And see, that's the whole thing. That's the whole thing because you may not have symptoms, doesn't mean you don't have COVID. You may never have a symptom
That's
and
absolutely
still
correct.
have COVID.
That is
So
absolutely correct.
because you feel fine and you don't have a symptom, you're going around all your friends, your grandma, and now they've contracted it from you and they're dead.
Yeah.
So,
Do you feel like
it's
that? I'm
go
sorry.
ahead.
Go ahead.
No, go ahead.
No, no. Do you feel like that's the main? Like that? Do you feel like that's one of the big issues
That
with COVID? That some people don't actually have the symptoms, but they still may have the virus.
oh yeah, absolutely. Absolutely. I think it is a main issue with the spread, but I think that really the main issue is they don't know anything about this disease. They don't have a
Okay.
treatment for this disease. There is no
Okay.
treatment.
They don't know
Okay.
nothing. They don't know anything really.
Well, I wouldn't say that. I think that it's like anything that is new, like any disease that is new, there's a learning curve. They have to first see how it reacts to know. If you look at the list of symptoms now, it's so long. When it first started, it was 4 things on there.
Yeah.
When my daughter got COVID, she had a headache. A headache wasn't even on the list of symptoms at that time.
Okay. So
My
did they
ex,
still?
my ex has had it twice.
So did they tell them to still quarantine for 14 days?
They quarantined my daughter for 21 days.
Oh wow.
They quarantined her for 21 days.
Okay.
Um, but now she was very sick. But when it started with her having a headache. And it
What
went
were
from a headache to her not being able to breathe.
and then she had other side effects from it?
Well, the funny thing is, after she left the hospital, because they did keep her for observation because she couldn't breathe. And they tested her and they didn't have the rapid test at that time.
Okay.
So after she left the hospital, then she got all of the other symptoms, the fever, the chills, like the flu, the body aches, but the breathing was her main issue because she
Okay.
does have asthma.
All right.
So,
So
but
which did
it all
I'm sorry.
started with a headache.
which leads to my next question for you all. So a person that has asthma or may be a diabetic, what are their risks of getting COVID?
High.
Well, I'm not sure about diabetes. I'm not. But,
Okay.
any type of, breathing issues, any type
Hmm.
of asthma, or a combination of things like that, they are at a higher susceptibility of having more severe symptoms if they get COVID. Now,
Right.
I read a study not long ago, and then it was on television that said people who smoke cigarettes are less likely to get COVID. But if they get it, they're more likely to die from it. And I thought, well, that's crazy.
Mm.
Okay.
I
So
I think people
what
get I
I'm
think
going to show right now
uh,
on the screen is what they're doing is it's a dashboard, and hold on.
I think people need to do more research of the symptoms with the COVID-19 pandemic.
But the thing is, until you get someone who has COVID, who has different symptoms than most people, you don't know what those symptoms are.
That's
As
true.
I said, when my
I can
daughter
agree.
got it,
I, I can agree with that.
right, when my daughter got it, she had a headache. Well, the CDC didn't have a headache listed as the symptoms of COVID. So
True.
she ran around 2, 3 days infecting people until she got a runny nose. It was a headache, a runny nose, and straight to not breathing.
So like you mentioned, there's a lot of symptoms that wasn't even on the list when this first started.
Exactly. And they keep adding symptoms because they keep getting,
Okay,
now that
what
we
I'm
have
getting
this
ready.
widespread testing, you know, they're now finding out the different symptoms of people who've tested positive that they've had. So now they can add those symptoms to the list.
Okay.
Okay, right now is on the screen is what I'm showing. Can you see that, Lady Allegia?
Yes, we can.
Says the symptoms of coronavirus.
Yes.
Okay, reading that paragraph. Anyone, starting with anyone, can
Anyone
help.
can have mild to severe symptoms. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness.
Now, here, keep on. Listen to
It
this now.
says, you need to back that up a little bit. Okay, I got it. It says,
Right.
watch for symptoms. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. 2 to 14 days after. People with these symptoms may have COVID-19, fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, diarrhea. This list does not include all possible symptoms. CDC will continue to update this list as we learn more about COVID-19.
And see, what I'm having a lot of people tell me when they thought they had the flu real bad and it was the worst they had, they feel like they had COVID.
Exactly. And you know, and they can still be tested, um, because even though they may not test positive, they may have the antibodies.
I have a
So, you
question.
know, go ahead.
How did you all feel about the influential of manufacturing with people making these masks? Do you all feel that can have an effect on someone too? As far as breathing failure, people that have lungs and lung cancer, like heart disease. Do you all feel like the manufacturing of these masks have effects on people?
Hmm.
I mean,
Wow.
I'm
You know
I
what?
I
No, no, no.
I
That's an excellent question.
I,
That's
I
an
mean I
excellent
think
question.
not to be cutting you off. I mean I
No,
just think
it's a
outside
great
the box. I
question.
think outside the box a lot.
Yeah.
Yeah, that's an excellent question. And you know, I think that, yeah, to an extent. And I'll say this, I remember in the beginning of COVID, people were running out getting, you know, they were telling you, you know, because there was a short of a mask, you couldn't find them anywhere, you couldn't buy them. And there were all these things, make a mask like this, use a charcoal filter, use a HEPA filter. And I'm like, why would you want to breathe that in? Why would you want to
Exactly,
breathe that into your lungs?
exactly my point, laser alluded. I mean, because if I don't know if you all remember, but that was a time when people were saying, "Oh, there's a shortage on mine."
Yeah, there was an absolute shortage of masks because I had to go to one of my husband's surgeon friends that I was showing
Okay.
April the other day. I got a
Hmm.
box of surgical masks,
Yes.
like,
Okay.
you know, real surgical masks.
Okay.
And, you know, people are buying masks anywhere. They're not medical masks to begin with.
Okay.
Um, People are wearing
Design mask.
designer masks. People are wearing, you know, fashion masks. And any covering is better than nothing at all. Let's make that clear. Anything you have
Hmm.
over your face is better than not having nothing. But
Okay.
in order to filter things out when you're breathing, your mask really should be cotton. If it's not a medical mask, it should be cotton. It shouldn't be polyester, you know, polyester and sequin. It should be cotton. No matter what you put on it, it should be cotton. And that's why they were telling people to, you know, make your mask out of washcloths because they're breathable. They're 100% cotton, not washcloths, dish towels. I'm sorry.
Hmm. So
So,
so
you know, your mask really should be cotton. If they can't be medical masks, they should
okay.
be cotton masks.
Okay.
So
But
people
Sorry
so
to
people with
interrupt for one moment. We had Pan that is watching on DRT, and Pan says when someone wears masks, they are not taking oxygen to the brain. In China right now, they don't have COVID. I hear Greek professor in Chinese university, they are finished with COVID-19 in 68 days, and they are living naturally without masks.
okay,
so people
I don't even know
so the
how to
people who
respond to that.
have okay
Well,
my
saying
response
you're not getting oxygen to the brain.
Why are you not getting oxygen to the brain?
I don't know. I guess this.
Okay, I no.
Oh, here. I'm posting it right now. He put it in. It's on the screen. What he see.
If you didn't get oxygen to the brain, you kill off brain cells.
Yeah.
Um, yeah, I don't know about that.
So
I don't.
I guess we need to Google. Is China doesn't have the corona anymore?
I don't know if that's true either.
I don't think
Hold
that's true
on.
at all.
I don't know. I'm not going to tell you
Googling
something that
it
I don't
right
know, and I
now.
just don't know.
Yeah, because they had a second outbreak.
So, so my
Hold on.
question, my
Okay, go
question
on.
to, my question to what Lady Elisa was talking about: is it best for people to wear a mask, a mask that's made from cotton?
It is best for people, if you don't have a medical mask, the best material for a mask is cotton. But
Okay,
again, any covering is better than none at all.
that's true. That's very true.
And wear your mask over your nose. You know, it said the thing that I read from the CDC just a few moments ago that April had on the screen, um,
Hmm.
it stated properly wearing a mask. You know, people don't wear masks properly. It's not a chin guard, people. I see so many kids running around with their mask on their chin. What's the
I
point of that?
I see a lot of people wearing their mask the wrong way, like you just stated.
Yeah, yeah. Or it's just over their mouth. Their nose isn't covered.
Right, and that makes more zones spreadable when people are talking or you walking past someone because it's
Uh,
airborne.
it is. It is airborne. And you know, not only that, yeah, it's airborne. And you think about that, it enters through your nostrils, it enters through your eyes, it enters through your ears because, you know, Dr. Fossey was telling people to wear glasses if you can, you know, to
Okay,
cover your eyes, or, you know, wear a mask with a shield because it enters into your ears, your nose, you know, your
yeah,
eyes.
yeah.
And I was telling April the other day, when I'm out, I have earplugs. I always forget them. I need to just throw a pair in my favorite three purses so that I always have them when I run out. But I always put my
Okay,
headphones in my ears. I don't have music on, but when I'm out, I put my headphones in my ears, and I wear glasses, so wearing glasses isn't a problem. But I make sure that, you know, my mask is worn properly and that
mm,
my ears are plugged in, you know, and that
right.
I have my eyes covered.
Because the air pollution is it's so congested, so that's another problem that can affect people, especially those who have asthma or breathing problems.
Absolutely. 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 April, did you Google that and find out if they have COVID in China right now?
Hold on. I'm doing it right now. I'm gonna pull the screen up. Okay, I got it. I got it. And so I'm getting ready to share the screen. Share the
Okay.
screen.
I mean, because honestly, there's a lot of stuff that's on this COVID list that wasn't
Now
on there.
That
look what it's
wasn't there.
showing.
Right.
Look
Be-
what they're showing for China.
because what are they showing? Let me see if I can blow that up. Daily change statistics 8,000. Each day shows new cases reported since the previous day, updated less than 10 minutes ago. I okay. So what is it saying?
So
I'm
there has
not.
been there has been
Okay.
it.
I don't understand how to read this chart, April.
So there has been new symptoms added by the
I
CDC. That's what you're
I
saying.
don't. No. She looked to see what were the COVID stats in China, and it
Okay.
has a chart up here, but I don't understand how to read this chart because it goes from April, July to November,
That was
but I'm not understanding how to read this chart. I don't.
right.
It
I
says each
actually
day shows cases reported since the previous day.
right because I actually see the chart, but like you said, I mean, I'm not really
April, are you
un-
with us?
understanding how to read the actual chart.
Because it says each day shows new cases reported since the previous day. So that would make you believe that there are cases, but again, I don't understand how to read this chart.
So that right. Basically,
So April must
basically,
not be
they're
with us right now. April must have stepped away. Well, let's see. In China right now, it says they don't. Oh no, that's her comment. April, I don't know where April went.
so basically there has to be an estimated update on the numbers. I'm not particularly sure are they accurate, but there has to still be a lot of cases coming in.
Yeah, she's away. I don't know what she's doing. It says I don't know. I don't know how to read
Yeah,
this chart. You know,
right.
it says I don't know. It says July 14th. Wait, that says July 20. Oh, July 21st.
Okay, sorry, y'all.
Okay, April,
Wait.
April.
Uh-huh.
I don't know. I don't know how to read this chart. Can you get us something that's written because I don't understand this chart
Okay, let me see. Okay, let me see. Let me go. COVID stats in
in
China.
China?
Yeah,
Yeah,
China today.
I don't want to graph
Yeah.
because I don't. No, I don't
I'm I'm
see
I'm
where
I'm
it's going.
I'm following you. I mean, I agree with you.
Hey, we just haven't. We're not saying we don't believe him. I just like to. When
We like facts.
yeah, and I didn't.
Can we get
Hold
um?
on. It's
Okay,
not
wait a minute. Hold on. Because I saw something.
okay. Let me.
Hold on. No, that's about economic growth.
Yeah, yeah.
Yeah, that
That's that. I know that's not. Let me see.
Yeah.
See, it's okay. Hold on. Because actually, it is showing zero. If you look at that bottom,
but no, because look on this side where
oh,
this is what I'm saying. Get me something written.
that
Because
one.
on the side
Okay,
it's saying, and see that's saying April 10th.
no, you got November 17th up there where it says 8. And see, I'm like you. I don't like
You
this chart.
exactly. Because
Yeah.
it's
Okay, hold
yeah.
on.
Wait a minute, hold on. Okay, that's in July and August, September. Okay, it says China coronavirus update.
Virus. Let's see.
Okay.
Now, this
China, coronavirus cases, 86,369. Deaths, 4,634. Can you scroll up or down?
yeah. Okay.
Okay,
I'm
newly
going
infected.
real slow now.
Okay, get
Hold
down
on.
past the deaths.
I'm going
It says
real slow.
last updated today, November 18th, 2020. Coronavirus cases
Right.
in China, 86,369. Deaths, 4,634. Recovered, can you go down past recovered?
Okay.
Because I can't see past recovered. Recovered, 81,411. Active cases, go down below active cases. I can't see it.
Okay.
324 active cases, currently infected patients, 1% serious or critical cases which had an outcome, recovered 81,411, 95%, deaths 5%.
But look how many active cases they only had. It's not gone, but only 324 active cases. Look at all of the cases that was recovered or discharged.
I see that 81,000, but look at all of the cases that they had in the beginning and all that died.
I know, but look where they're at now.
Yeah, that's where they are now. But seeing as though we don't even know how long it was in China before we found out about it.
Because
you understand?
they only had 86,369 cases, 4,634 deaths. Recovered
Right.
81,000. Hell, we got that many in Illinois in one state.
Absolutely. But again, as I'm saying, this is as of now. You don't know. In the beginning, people were dying left and right.
Yeah.
So we don't know because we've had it since March. They had it long before that. So we don't know how long they've had it. Yes, it's great, but they still have cases.
Hey, Raymond.
And
That's true.
out of the cases that they have, the majority of them, almost all of them, 99% of them are in, it's very mild.
Yeah. Considering all the other symptoms.
Exactly. Exactly.
Okay, my beautiful people and my beautiful listeners. We are talking about coronavirus. We talked about it is weird. It's real. We talked about the symptoms. We've talked about everybody should wear face coverings because you cannot say don't wear a face covering if you're around people, but you go to Walmart and basically we were placing an emphasis on children because under the age of 2, they're saying that, there's no requirement, but we're suggesting that they should have some type of covering over their nose and mouth as adults because they don't know much about COVID-19 and you know, they do get snotty noses, and it's just supposed to come from droplets, sweat, mucus, and things like that. And so what I'm going to show you now is what we're dealing with in Illinois, what our stats are. Well, first of all, I'm going to show you everything that, and you can read this. Can you see it?
No, nothing's on the screen. No,
Nothing's on the screen. Okay,
no.
Hold on. Yeah.
What did you all think about the actual COVID-19 vaccine?
What do we think about the actual what? I'm sorry.
The actual vaccine that's supposed to be a breakthrough.
Oh,
I
I was
wouldn't
going
take
to
it.
show that.
I wouldn't take it.
Yeah.
Yeah. Do you all feel like it's the same vaccine as the flu vaccine?
No, I don't
Yeah.
take those either. But
Right. I
you know,
definitely don't
they
take
do
them.
help. They do help some people. I don't take them. A vaccine takes a minimum of 8 years. It's normally the normal amount of time for a vaccine to be developed and to be administered to the public is 10 years. That's the average. 10 years from development to public administration. You made a vaccine in 3 months. In 3
Okay.
months,
Okay.
they've made a vaccine that they claim they're getting ready to give to people in December and January. I'm
They
sorry.
can't do that.
I
They
wouldn't
have to
take
do
that.
trial studies first.
Well, they're claiming they've done trial studies, and that's what I'm saying.
Well, but they failed.
Well, yeah, 3 of them were shut down because people started getting mysterious illnesses after they had the vaccination. They're trying to claim, oh, that's normal. It's not normal.
So
You know,
you're saying a scientific vaccine cannot be administered to DC and the CDC, if I'm correct, within 10 years?
no. What I'm saying is the average amount of time, the average, I'm not saying every vaccine takes 10 years, but
I get you on that.
the average amount of time for a vaccine to be developed, tried, studied, and brought to the public, the average time is 10 years from development to getting it to the public. That is the average time of most vaccines. So now, what is going to make me believe that this vaccine is first and foremost is safe?
Good point.
Secondly, that it's effective when you've done it in 3 months. Like, I'm sorry. There is you don't know enough about this disease. What are you making this vaccine from?
That's another good point.
You don't have a treatment for this disease. So how are you going to, I don't understand. How are they making a vaccine for something that they don't even have a treatment for? Because you got to know how to treat it to prevent it, right or wrong.
You're absolutely correct.
So how are you going to prevent it in this vaccine when you don't have a treatment? What is in this vaccine that's going to stop the COVID virus or the coronavirus?
Right.
I do not trust it. I'm sorry, because I don't care what these scientists are saying today. It has never been done before. No one has ever made a vaccine and given it to the public in 3 months, in a year, in 2 years, in 3 years.
Right. So
Not
basically,
in this country.
Right. So basically, what treatment has been done or studied to even make the public believe that it will actually work?
You know, I'm not, I don't know. I don't know. You have people say, I'll take it. Well, you go right ahead. You can take it from me. Because you don't know what effect this vaccine is going to have on people, either short term or long term.
So
You
basically,
understand?
right. So basically, we're on the same page with this because that was going to be my next question. Do they actually know what type of side effects people will have?
No. This is why you have years of trial studies on a vaccine. You understand? Because
Hmm.
you have to have different demographics to find out what the effect is going to have on that group of people. This is why
Exactly.
vaccines take years to develop and be brought to the
Exactly.
public.
Exactly.
So I'm sorry. I don't care what these scientists say. I don't believe them.
I'm following. I'm listening. I'm listening.
You're not going to make me believe them. Now, anybody who wants to run out and get the vaccine, you go right ahead. I won't be doing it. My family
Right.
members won't be doing it. My
Okay.
grandchildren and great grandchildren surely won't be doing it,
Okay.
because
So
there
have you?
just is not enough research
Hmm.
or even studying of this vaccine to make me believe that it's going to be safe. I don't give a damn about it being effective. Is it going to be safe? And
So
that's
my question.
something that they cannot tell me with any validity, because it just hasn't been enough time for them to know.
So my.
Okay,
So
Which
my
is
next.
I
why,
want to hold on, you guys. I want to share something else that I'm going to bring on the screen, where it's talking about these clinical trial
mm-hmm,
treatments.
mm-hmm.
Hold on. Yeah, we like to have facts in here. Yeah. Hey, B Sparrow.
Hi, B.
We miss you, B.
Miss you.
Okay, share screen. Hold on. Yes, I do talk to myself, but I don't answer myself. So
Oh,
now,
I do both, and I don't care who
oh
knows it.
Lord, have mercy. Okay. So now, okay, this headline says clinic. You can read it. Read out
Okay,
loud. Okay.
Okay.
let me blow it up. COVID-19 clinical trials are failing to enroll diverse populations despite awareness efforts. Didn't I just say that?
Yes, we did.
Okay.
Okay.
Okay, you got to scroll down.
Okay. Now, just read what this says. Okay.
It says, hold on. Okay, wait, we're a little. It's been well established that COVID-19, at least in the United States, has disproportionately affected people of color. And yet, clinical trials of treatments and vaccines for COVID-19 have so far failed to enroll diverse populations that actually reflect society. So in other words, they're not testing Black people. Well, that's because we're not stupid. We're not running up there to be a damn lab rat. Okay? So I'm not blaming them. We've got better sense. What's that? Haley
April.
Porno is an oncologist at the University of California, San Francisco. She's been studying the gap between real-world demographics and clinical trial enrollment. She recently called into Stats podcast, The Read Out Loud, to discuss the issue of diversity and inclusion in COVID-19 clinical trials.
Yeah.
This transcript has been widely edited for clarity. Okay, can you?
That was it on that one.
Okay.
But it's letting you know that we aren't doing it.
Exactly.
We're not doing it. They're not gonna.
April. DJ Pete
Yeah.
said that he sent you something on Facebook concerning COVID-19.
Okay. Hold on, Pete. Okay.
So, Lady
Because
Elisa,
now
people
I'm sorry.
People are not reading the demographic.
Well, what they're saying is they don't have any.
Okay.
Basically, there are no Black people or Hispanic people that are in these clinical trials. And that was to the point that I was making. You have to do clinical trials. You have to do them on several different demographics to know how that vaccine is going to affect either people of color or people with certain illnesses. You understand what I'm saying?
Mm-hmm.
Or people with predisposed conditions, and they've not done that.
Okay.
So and again, even if they had, it has not been enough time. It's been 3 months, 4 at best, since they started developing this vaccine. Now you've developed the vaccine, you're testing people with it in 4 months, and you're talking about bringing it to the public in another month or 2.
Mm-hmm.
I don't see how anyone with half of a brain can be okay with that. Because it's just not safe. It's not safe. How can you make me believe this is safe when you've had 3 clinical trials suspended because people in those trials had developed mysterious, and that's exactly what it said, mysterious illnesses since being given the vaccine. And then they're saying, oh, well, that's normal. No, it's not normal. It may be normal for you to suspend 1 trial.
Like you said, the key word, mysterious.
Mysterious. They develop mysterious illnesses. You suspended all 3 trials. Now all of a sudden, we're good to go. And this was just a couple of weeks ago. This wasn't 3 months ago, 4 months ago. This was a couple of weeks ago, if that it was on the news.
Mysterious illnesses.
Mysterious illnesses. People in the trials had developed mysterious illnesses. They didn't even tell us what the illnesses were, I guess, because they were mysterious. I don't know.
Right.
But I cannot, in good conscience, take it. I can't tell anybody else to take it.
I'm going to share another screen where they talk about the clinical trials and how they have been suspended.
Exactly.
So if
I
there's
saw it on the news.
mysteriousness, if there's mysterious illnesses,
Yeah.
so that means, I don't know if I'm right, I'm just throwing it out here. So that means they don't have accurate demographic numbers
Oh,
of
no, that's
illnesses
not. Hold on,
from
that's not the
from
one I wanted to.
from
That's the
different
one.
races. Am I correct?
Correct. Correct. Absolutely correct.
That's what I get from it.
That's what it is. And the thing is too, there are things that affect men differently than women and vice versa. You know what I'm
Hmm.
saying?
Right.
It's just
Cause like,
too many variables
Okay,
that they have not studied.
yeah.
cause like you said,
Okay,
they
B,
haven't
can
even
you?
they haven't even mentioned
Yeah,
the illnesses.
yeah.
No, they
Uh,
haven't.
B, can you read the first two paragraphs? Sorry to interrupt. This talks about all of the trials that they have started and have been suspended. So, can you see that, B? I mean, Lady Alicia, can you see
Okay,
that?
yeah, yes, I see it. It says
Okay.
the COVID-19 pandemic is disrupted clinical trials worldwide with long lasting effects on medical science. Aaron Van Dorn reports the COVID-19 pandemic has created massive disruptions to clinical trials research across the world. As in other aspects of life, the virus has severely affected the ability to conduct trials in safe and effective ways. This is especially true when considering that trials often deal with vulnerable populations who are most at risk from exposure to COVID 19. Thousands, thousands of trials have been suspended or stopped because of the difficulties in continuing under lockdown conditions. Oh, that's bull. Even as those restrictions have begun to ease in parts of the world, at the same time, the pandemic has seen an unprecedented reorientation in clinical trial research towards COVID 19. Both of those aspects, the disruption and the fast, effective readjustment to address a new challenge, ensure that the effects of the COVID 19 pandemic will be felt in clinical trials research long after the initial effects have faded.
So
Clinical
what would
trials
that
have
be?
long been, okay, wait a minute. I
Okay.
really want to read this. It
Okay.
says clinical trials have long been a premier method of testing and validating new drugs and therapies. New drug approval is predicated on successful trials into the safety and efficiency of new treatments. Trials can involve hundreds of different sites around the world, all with different conditions and facing different effects and government regulations on what is permissible. Once you start looking at the number of people involved in clinical trials, the scope of the problem begins to seem daunting. In addition to researchers, researchers formulate the protocol for the trial and work to secure funding from either government foundations, pharmaceutical or device manufacturers, or a combination of the above. I want to read that again because I really want you all to get that.
Okay.
Okay, but in addition, researchers who formulate the protocol for the trial and work to secure funding from governments, foundations, pharmaceutical or device manufacturers, or a combination of all of the above. Now, what
Hmm.
that is saying to you is that the people who are conducting these trials are securing funding from people who want to sell their products. That's basically what it's saying. Pharmaceutical companies, medical device companies. So again, I'm real weary about, this vaccine. Clinical trials include clinical caregivers and nurses who work with patients. Okay, I want to get to where they were suspended with the people with the mysterious illnesses. Can we find that one?
Yeah, hold on.
Excuse me, because this is all very daunting to me. It's the same as with, you see all these commercials on television about drugs. Ask your doctor about this drug. Why would you ask your doctor about a drug? You're not a doctor. If you have an illness, your doctor is supposed to correlate the best treatment plan for you. They know what drug is going to work for you.
Which goes back to my initial question earlier of how you all feel about these masks coming from different manufacturers.
Well, again, if they're not medical masks, then there's a risk of lesser protection. People were telling you to, in the beginning, make your own mask, use the HEPA filter. Well, HEPA filters are made from fiberglass. Why would you want to breathe in fiberglass?
That's a good point.
So
why would someone want to breathe in fiberglass?
Something made from fiberglass, right?
Come on.
They were telling you, use HEPA filters, use vacuum cleaner bags, as filters in your mask. Like, how about use common sense?
That's true.
My daughter bought masks with charcoal filters, and I said, why would you want to breathe in charcoal?
That stuff is all chemical.
Why would you, and it wasn't even a filter that really had a good filtration system. It was like you could literally see the charcoal under the little film of material. Why would you want to breathe that in?
That's exactly because I tell you, after I wear my mask for so long, and it don't matter if they the surgical, the ones, I can't wear them things long. But again, I'm getting ready to show you another study that was halt. Like I said, they're doing a lot of studies, but
they're doing a lot of studies, but not on people who have the highest risk of contracting COVID. So what good is this vaccine going to be to them?
So
what good is this vaccine going to be to black people if they're not doing the studies on black people?
So read what this one says, how they halt another clinical trial.
A clinical trial to evaluate the safety and effectiveness of hydroxychloroquine for the treatment of adults hospitalized with coronavirus disease has been stopped by the National Institutes of Health. But they told you in the beginning when Trump said that it was not a treatment for coronavirus. A data
So
and safety monitoring board met late Friday and determined that while there was no harm, and I don't believe that, the study drug was very unlikely to be beneficial to hospitalized patients with COVID-19. After its fourth interim analysis in the DSMB, which generally monitors the trial, recommended to the National Heart, Lung, and Blood Institute, part of NIH, to stop the study. NHLBI halted the trial immediately. The outcomes related to COVID-19 treatment with hydroxychloroquine among inpatients and symptomatic disease study, or ORCID study, was being conducted by the Prevention and Early Treatment of Acute Lung Injury Clinical Trials Network of NHLBI. The data from this study indicate that this drug provided no additional benefit compared to a placebo controlled for the treatment of Corona-19 in hospital patients. So hydroxychloroquine has no benefit for people with COVID.
so from the public
And
health,
neither does bleach.
so from the public health resources, what
Okay. I'm
what
also getting
waste
ready to
what
share.
waste have the highest risk of COVID?
The highest risk of COVID is among Black people.
Okay.
The highest risk of COVID is among Black people. Hispanics are the second highest. But the
Okay.
highest risk of COVID is among Black people.
Hmm.
And yet they have no Black people in these clinical trials for the vaccine.
Okay.
So
Now,
again,
I need you. This is another one that talks about. It will start from the beginning.
So like you
okay,
mentioned earlier, that goes back to the mysteriously illnesses.
exactly. Okay, it was there. What happened to it? Okay,
Okay.
I'm getting ready to read this. Okay, there we go.
Wait a minute.
It says, no, we're good. Don't move it down.
Okay.
Nearly 200 companies have stopped or delayed their trials over the pandemic, and life science analytics firm Global Data has dug into the data and found the main culprit has been suspended enrollment. People ain't signing up for this mess.
Right.
Drilling down into the numbers of the causes stopping these tests, it found 67.3% of clinical trials disrupted by COVID-19 are due to patients not being allowed into studies. Patients not being allowed into studies. So you're not studying the person sick with COVID.
Hmm.
While the delayed start of planned trials follows 18.4%, finally, 14.4% of trials are currently being impacted due to slow enrollment. Within the 14.4% of trials affected by slow enrollment, 20.7% of these are specifically due to the availability of sites and investigators. Okay, can you scroll down?
Okay. Hold on. Hold on. Hello.
Brooke Wilson, Associate Director, Trials Intelligence at Global Data, said non-COVID-19 trials are being delayed or deprioritized, and clinical trials for respiratory indications, may be further impacted. Stop moving the screen.
Oh, okay.
Hmm.
All right.
I lost my place. Okay. Many hospitals that serve as trial sites are being inundated with COVID-19 patients and are no longer available. For that reason, many investigators may be repurposed to COVID-19 drug discovery trials or treating COVID-19 patients, whilst the activation of sites for non-COVID-19 trials are being deprioritized. There is also a high risk to subjects in a clinical trial who have a serious chronic or acute condition that affects their immune system, giving them a greater chance of contracting COVID-19.
Okay. Have you read all of that?
No.
You want
Can you all see my question that I'm typing in the chat?
huh?
Can you all
Okay.
see my
Check this
questions that
out.
I'm asking?
I
Huh?
don't. Put the questions up. Put the chat up, April.
What are you putting the chat? Are you putting you putting it on Spreaker?
I'm putting it
Oh,
in StreamYard and speaker. I'm not sure if you
Hold
all
on.
see them. I'm still
I
learning
don't.
how to use this app.
I don't see them.
Okay.
But I think April has to put them up there.
Okay.
Oh, yeah, hold on. Because I just got a ride to take me over here to my aunt's house, and they told me they weren't gonna be here till 3, and they just called and said I'm outside. Hold on. The
Okay.
question that Chuck asked. Okay, he said, April, what are some of the mysterious illnesses with the COVID-19 pandemic? I'm gonna let you answer that show. And
Okay.
we're gonna have to end the show.
Okay, no problem. I don't know what the illnesses
Say
are. They just
Okay.
said that the illnesses were mysterious. That's exactly what they said. They just
Okay.
said mysterious illnesses. They never said what those illnesses are. So I guess we will never know.
Yeah.
You know?
Yeah.
I mean,
Right.
when you say mysterious illness, that makes me feel like it's something that you've never seen before.
Correct. Exactly. Something that we may not even know about.
Exactly. Because, I mean, doctors know illnesses, they know diseases, they know what they are.
Okay.
Mysterious means
Give some
exactly that.
closing statements, because I do.
Yeah,
Okay.
are we coming back? Are we going
Chuck,
to come
will you
back
give
this
a
evening?
closing statement? Yeah, we'll come back once I come back and we'll finish this. Chuck,
Yeah.
you want to give a closing statement for right now? We'll come back and do this as soon as I come back.
I mean, I feel like we covered a lot of information about this pandemic. I hope we gave more information to the listeners, and I would love to come back and do another panel.
Definitely.
Yeah.
I just hope everyone stays safe, wear your mask, wash your hands. And I want to just make a point too. Hand sanitizer is not soap and water. Hand sanitizer should be used when you are not around soap and water. Wash your hands in soap and water.
I definitely agree.
Okay.
Stay safe, everybody. We'll see you guys later. Thank you so much.
All right. Okay. All right. Let me make sure I end broadcast on both ends.